the very beginning, I did a lot of self-medication because of the high fevers, the spiking fevers, constant fatigue, general body weakness, joint pains. I was doing a lot of self-medication. I treated for malaria. I was heavily on painkillers. All the treatment did not work. I was relying heavily on painkillers. They would make me feel better. Pain would go away. I would try to function as normal as I possibly could, but I was getting weaker and weaker because the condition was not being addressed, to the point that the painkillers were not really working. I came from mild painkillers to somewhat moderate to those heavy, very heavy painkillers.
That is the voice of Mariam Naseje sharing her ordeal after her over-the-counter purchases to treat common disease symptoms before hell broke loose and she decided to finally go to an actual hospital and get the right diagnosis for her condition. The associated ills of self-medicating are a growing evil among the Ugandan population, especially because most of the treatment decisions depend on the patient's ability to pay out of pocket for health services. However, our investigations established that some pharmacies and dispensers are not ensuring safe self-care practices and are issuing out medicines on self-prescription. They argue that the mission of government is to ensure access of medicine to all people. According to Dr. Charles Olaro, the director in charge of curative services at the Ministry of Health, such practices do not meet the health guidelines on self-care, further emphasizing the need for best self-care practices.
We don't encourage self-medication, so it means that you only take the treatment for which already diagnosis has been made. If like a patient is already on ARVs, then what we want that you are there to what? That medication. If it's diabetes, then already you know you are being problem on insulin. So you already know your diagnosis. Then you can be able to get the drugs which you want. But it's not that you just go and buy drugs from the over the counter.
Among other unethical practices is the staffing of volunteers to cut remuneration costs who have less experience and limited information on adverse effects of these over-the-counter drugs. According to Dr. Olaro, VHTs play a key role in enforcing self-care for preventive management. He also cautions end users on self-medicating, with the exception for over-the-counter products that are already consumed by users, such as family planning and self-injection.
Whereas we give in self-care, we have to be cognizant of first of all the products, because we also are interested in the product. That's why we say that even when you do an HIV self-test, it should still be confirmed by what? In the health facility. Because we've had others where they have tested positive, but in reality they are what? They are negative. So they need to be confirmed by what? The health worker. So if it comes self-injection, like if for instance for family planning, those ones you can go and buy them over the counter, because already you know that I have already been taking self-injection, so it becomes easy. But we don't, basically for antibiotics, we discourage the self-medication.
Abiaz Ramwiri, the National Drug Authority spokesperson, says that the treatment decision for most people is driven by their ability to pay for their medical needs, given that approximately 70% of people in developing countries pay for their health by out of pocket. He, however, asks practitioners to observe critical roles to ensure an independent review of prescription before dispensing to avoid any medication errors. Further adds that there should be a clear separation of prescription and dispensing. A clinician is supposed to diagnose and prescribe, whereas a pharmacist is supposed to review the prescription and dispense the drug. In order to tackle issues of misinformation and unethical or unsafe self-care practices, different health interventions have been made to achieve better health outcomes on self-care, such as mobile health applications. Peter Nkobwa, a private innovator, explains more about this application called MoSmiles.
This year, Miles of Smiles Foundation commissioned a mobile health application called MoSmiles app in Uganda to enable patients suffering from chronic illnesses to take charge of their health. The app helps people living with HIV, diabetes and cancer to adhere to medication with time and appointment reminders and related health information through chatroom interactions with health experts.
The World Health Organization has provided guidelines in its good practice statement that pharmacy owners need to embrace to improve practice and ensure self-care for all individuals, hence responsible self-medication practices. In conclusion, self-care is not a standalone and requires professionalism from behind-the-counter personnel for medical prescription to appropriate information sharing. Therefore, although the world concluded commemoration of Self-Care Awareness Month last week, it is worth noting that self-care interventions, if applied in a safe and supportive environment, does present an opportunity to help increase people's active participation in their own health, including patient engagement. Reporting for KFM News, Kevin Githuku and Esther Nakalya.